Alec has the bodysuit on, which consists of N95 mask, the face shield, the trauma gown, 2 pairs of gloves, and the knee-high boot covers. So first you need to inspect all your equipment, make sure it is intact, it has no rips, no tears. So you have the full coverall, which has the boot covers included, and then the hood for the head, N95 mask, face shield, and 2 pairs of gloves. The gloves are an extended cuff glove, so they will protect you accordingly. So first we have the fluid-resistant barrier on the ground. Kate has already inspected her equipment, so she knows it's intact. Now would be a good time to take a bathroom break before we do any patient care. Drink some fluids in case it's warm out so you don't become dehydrated. You would also secure any watches, jewelry, necklaces that you have, because you don't want anything that would pierce your protective garments. You are going to pull your hair back if you have long hair, which she has already done. And we're going to have a cleanable stool or chair. So once the patient care is done, we can clean that chair off with bleach wipes. Alright, so first she's going to sit in the chair and place her feet into the protective coverall. And as you're pulling it up, you want to be careful not to rip or tear the protective garment. Now you're going to go ahead and stand up and just pull it up to your waist. So next, the assistant will hand Kate the N95 mask. She'll go ahead and properly apply that. Then the assistant will hand her the first pair of nitrile gloves. So if you wear a medium glove, you'll go medium pair first, and then a large pair for the second pair. Her first pair of gloves on. Now she's going to pull the suit up and put her arms and shoulders into the suit. And if you do have a suit that has a hood attached, you want to make sure the hood is tucked in. Okay. Now the assistant will hand her a second pair of gloves. So this is where you might have to assist her, Alec, and make sure they're up far enough on her sleeves, and make sure the gown stays tucked in.
Farm life doesn't prepare you for this.
It goes over top the sleeve, right, Cap?
Correct.
So don't do that.
You want to make sure the gown is well tucked in for that second pair of gloves. Good. All right, now we're going to put the head cover on. Head cover. Alright, so next we'll apply the trauma gown. So Alec will help her with that. It's just a plastic apron. Okay, last step will be the face shield. Okay, good. Make sure that's comfortable. You can put a small piece of tape on each side if it seems to be sliding off, which it's not. Alright. And we want to do one final inspection by your assistant to make sure there's no exposed skin anywhere before you go into the patient treatment area. Good. Next, while Kate is still in the patient care area as she's ready to exit, She will wipe down any gross contamination she sees while she's still in the hot zone or the patient care area with bleach wipes. So she has done that, and those have gone into a infectious waste container that's in the patient's room. She will then exit the patient's care area and come out into the warm zone where she is now, and then Alec will assist her in wiping down the rest of the suit before we start the doffing process. So Alec will hand her a few wipes. She'll wipe her hands thoroughly. And again, these are bleach wipes. And as you discard them, you can just drop them onto the non-permeable barrier. Next, we're going to go to the left arm and start from the shoulder and work your way down. Clean wipe. Right arm. Next will be the torso. At this point, you can remove that trauma gown and drop that on the floor as well. And then take some more wipes and do the torso again. Then the left leg. The right leg. Then we'll do the head. Make sure you include the neck and the parts of the head cover. And then for the back, what you can do is your assistant can use a long-handled brush that has park wipes on it and wipe your back off from there. Alright, now you have to wait up to 5 minutes because you want that bleach to dry on the suit before you do anything else. So again, we're going to wait a few minutes until the bleach is dry. Alright, it's been 5 minutes, the bleach is dry. She's going to clean her hands again with bleach wipes. So next step, she's cleaned her hands once again. She's going to lean forward and remove the face shield. Just dropping it onto the floor. And then you will remove the head cover, kind of pulling from, again, the outside and pulling it forward. So she's removed the head cover. She'll receive some hand sanitizer. Next you'll do the zipper. Be careful not to touch the inside of the suit at any point. You want to keep the gloves on the outside of the suit. Alright, you will then remove, first you'll do hand sanitizer again. Once it's dry, you want to remove the first pair of gloves, the outside pair of gloves. Hand sanitizer. Okay, good. So you sanitize one more time. Now reaching from the outside of your shoulder, you want to pull it down off your shoulders.
Here.
Yep.
Hard in place.
Yes, it doesn't stretch. Okay. Then you want to slowly remove one arm. Good. And then the other arm. And then hand sanitizer. Okay. You just want to, now you can touch the inside and just slowly roll it down off your hips. And then you can sit in the chair behind you. Make sure it's down far enough. Good. Okay. Hand sanitizer. Now you can, from the inside of the suit, you can pull it off one leg and then pull it off the second leg. But you want to be careful not to put your clean shoes down in the warm zone, so you want your shoes to be outside the warm zone when you put your feet down. Good. Hand sanitizer. And then you can lean forward and remove the N95 mask. Hand sanitizer. Once that's dry, carefully remove the last pair of gloves. Hand sanitizer. The doffing process should take place at the hospital. Once we do a transport, hospital staff will be able to assist you with the doffing process and have the equipment available that we need. The doffing will take place at the ambulance entrance at University Hospital, and trained staff from the hospital will be there to assist us.